Good afternoon, Monday, the 24th of May, 2021, as always, and this is the English language summary for the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So first of all, thank you to Dr. Pisamai, as always, for the Thai language briefing. Some important issues she mentioned was that we are using evidence-based data. You saw in the briefing just now, we had some visual aerial maps of Bangkok districts in particular, when we use evidence-based data in analyzing the different situations in different specific districts in Bangkok. Now, the important clusters that still pose as a risk and threat in Bangkok are, of course, the many construction sites. The many construction sites that have a lot of workers, construction workers, Thai, including Thai and migrant workers as well. So that remains a risk for us. What we have been doing now, in addition to fight off this risk, is that each district in Bangkok, up to 50 districts in Bangkok, have set up special committees, operational committees, to look into each of the outbreak in their districts under their control. Now, I'd like to start with the numbers that we have recorded for today, the 24th of May. We have new confirmed case recorded today at 2,713. And out of this number, the majority, 2,458, are from local transmission, 49 are from overseas infection, and 206 found within prisons in penitentiaries. Now, with the number 2,700 being the new confirmed case for today, we have new recoveries at 1,565. The active cases being treated currently, still people with COVID in Thailand, amount to 45,307. We have 30 new fatalities today, making the cumulative at 806. The overall situation still continues to see an upward trend, despite the fact that there are 27 provinces today with no new cases reported. As we mentioned often, the hotspot remains in Bangkok. Existing clusters, mostly in penitentiary facilities, factories, surrounding settlements, all of which have been put under the bubble and seal and area quarantine measures. Workers, construction workers, their movements in areas under quarantine measure continue to be restricted. And active case finding and contact tracing have been intensified nationwide so as to stem the spread of the outbreak. Now, Dr. Pisamai, in her Q&A session, talked about the one issue which is of interest, of concern, perhaps to the English language community, which is about the examinations in the international schools in Thailand. Now, this has been confirmed by the Permanent Secretary of the Ministry of Education, Mr. Supat Jampatong, reaffirmed that the CCSA has already approved the Ministry of Education's request to hold the GED, the SAT, and the A-level examinations and other types of examinations for international school students currently studying in Thailand. This has been approved since the end of April. Now, as a result, these exams can and will be held as per normal for this calendar year, with the necessary public health measures, of course, and related procedures and protocol in place. Those taking the exams are encouraged to strictly follow social distancing and public health measures for their own safety. Now, of course, the Education Ministry will be looking into this so that all the concerned schools, related schools, will be on the same page, and this will be implemented accordingly. So, confirm that it has been approved prior already and can and will be held as per normal schedule. Another piece of information is about COVID variant not resistant to vaccine. Now, the Department of Disease Control has explained that the COVID strain, which has been detected found in India, has been found among workers at a construction camp in Bangkok's Laksi area, as you may have learned from the news already, that it is not resistant to AstraZeneca vaccine. Now, the Director General of the Department of Disease Control said that 15 patients infected with the strain include 7 males and 8 females, with an average age of 46. And of these, 12 people were workers at the Laxi camp, while the other 3 were their family members. And he said that information from the Public Health England states that the variant first found in India spreads in the same pattern as the UK strain, but there is no evidence of more severe symptoms or a higher mortality rate. So this is between the variant first found in India and the variant first found in the UK. And the Director General also added that the strain first found in India responds to the AstraZeneca vaccine, which is one which Thailand aims to use as its primary vaccine. So today's briefing will be quite brief. We will be having a program after this, and then perhaps in the English language summary in the coming days, we can summarize to you each of these important programs with various officials from various agencies coming to talk about in specific detail the COVID situation in the work that they do. So this is the update that I have for you for today. I believe that during the weekend, since that's Friday, and then over the weekend, we had a lot of talk about the vaccination plan and arrangements for foreign nationals. So if there's any updated information about this issue, I'll inform you as soon as possible. So for today, thank you very much for your attention, and we'll see you tomorrow. Sawasdee krap.